So during this time, we want to bring all the videos of our presenters back up, and we'll begin with our panel discussion. Okay, we're just gonna bring everyone back up. All right. So one of the first questions that I have for you all, and this question came up particularly when Briana was speaking, and it was a question from Tony Gar. Are there any TenCare MCOs or managed care organizations accepting doulas in their network? Or Ricki might be able to speak to this as well. And if so, what's the level of payment?
Oh yeah. So I was going to just say like because one, I want to clarify some pieces. So and I put this in the chat. So like speaking to like so when it comes to reimbursement and how like different legislatures, including Tennessee, like certification is tied to reimbursement. And so folks want like a certified doula just because, you know, that's just how things are like set up. Like and like Ricki said, like these certifying agencies are, you know, in a lot of ways problematic. And I definitely like agree with that. And so anyway, so I just want to like make sure that's like clear that like in other places in Tennessee, like last year, like some um legislators worked on a bill, and then this year they worked on a bill trying to get doulas to be reimbursed by TenCare, and you know, which it has a fiscal note, but it's tied to like certification from like, you know, these big name like certifying agencies. That's not legislation that like Healthy and Free worked on. So what I was saying during my presentation is that like there isn't political will for like doulas to get reimbursed at the legislature. You know, like that's just like honest. And like folks don't understand what a doula is. And, you know, I've heard that like Governor Bill Lee has said that he doesn't think doulas are necessary, you know? And so anyway, which, you know, we all know that that's not the case, right? Doulas provide like wonderful service, and I'm also like a trained birth doula. I think I mentioned that. And so anyway, it's a multi-year step trying to get to get to the point where doulas are, you know, reimbursed by TenCare. The rate that they're trying to propose now is $350, but like Ricki said, that's so, you know, inadequate because there are doulas who are doing this full time. To answer the question about, I guess, what like how reimbursement looks currently, and I like found some links where from like some doulas, and they talk about like, you know, different insurance companies, private insurance companies who do reimbursements. And as far as the particular question, I will have to do more research around that. One doula I know, she like has on her website that in different like counties, like there like is money that could be designated for doula care, but like, you know, as it currently stands, like doulas aren't able to get reimbursed by TenCare. So I have to do more research on that particular question, or maybe Ricki, you know, has some thoughts around it. But I do want to uplift because again, like sometimes we get in this conversation about reimbursement, people forget the other piece of that is that like they're trying to like get like only certain agencies to like do the certification, and that creates an additional barrier, and that pushes out Black and brown doulas from being able to provide this necessary support.
I'll just add. When it comes to like getting covered by insurance companies, because I've had another doula kind of help me through the process. The client is responsible for all payments, and I always tell them to discuss it with their insurance company prior to making the decision if they need to be reimbursed. Because what will happen is your doula will have to have a provider number, and it's free to obtain. A lot of people don't know that, but you have to have a provider number and that information. And once the service has been rendered, once you have had your baby and all payments have been made, you would then receipt the service with your provider information, and the client would take that to their insurance company to be reimbursed to them when it comes to paying for a doula. But as Brianna said, when it comes to the reimbursement for like the trainings, it's one of those things where you make that commitment, but if that's not how much your training costs, then it's like $350 from me would have covered some of the books I bought for my training certification. But it would not touch a dent in what I paid for my certification. But that is something I saved up for so that I could be a brown face that brown mothers could go to for doula support. You know, that's a choice I made. But everyone who would be great at doula work can't make that same sacrifice.
Thank you, Briana and Ricki. And then another question around just coordination of coverage and eligibility. And this question came from another question from Tony, actually, which is the coordination of care option for pregnancy available through all MCOs? And that came up, Emilie, while you were talking, but I welcome you all to speak to that question.
Yes, it is. They each have their own little name for their pregnancy management care program. So these programs do things like provide a point person that the pregnant woman can contact at her health insurance to understand what is her coverage. That person can help her schedule appointments, making sure that she's hitting the different appointments that she should be having and different services that she should be having during her pregnancy. But again, each of them do offer this program. And there are some postpartum benefits attached to those programs as well, things like breast pumps and that sort of thing. But in order to get enrolled in those programs, I help a lot of mothers enroll, and I know very few that are actually enrolled in these programs because you have to be able to, basically, in order to find out about it, you have to read through the manual that you get. Some of the MCOs do outreach to mothers. They might call them once they're enrolled and say, we see you're enrolled in our pregnancy. But if you're getting calls from health insurance agencies, a lot of times you're thinking they're spam calls, you're not going to answer them. So there's a lot of barriers to enrollment into those programs, but they are available through all the MCOs.
Excellent. Thank you, Emilie. And Ricki, did you go ahead?
Yeah, I just wanted to add, I was a teen care mom 6 years ago when I had my daughter, and so I don't even remember. I was enrolled in one of the case manager thingies, and I don't remember how it happened. I can honestly not tell you, but I had someone call me like every month, and they would ask me about like, am I making my appointment? What time is my appointment? Do I need assistance? They would ask about like what food I was eating, in terms of like, was I getting my nutrition, if I needed any additional assistance. So it's very beneficial to moms to be a part of it, but it's one of those things that if you don't ask the question, or if the person that signs you up isn't making sure that you know this additional thing is there, then it won't happen. And so it's good to know and to share that with the people who are signing mothers up for teen care. I know we have several nonprofits in Memphis: Choices Reproductive Health Center, Life Choices, which is a religious nonprofit that provides free adoption services for moms. They often, when you come in and you're pregnant and you're going to keep your pregnancy, they prepare you for signing up for teen care. They give you confirmation of pregnancies to take to the health department to sign you up for teen care. And they list out a lot of information, but that's something that a lot of those agencies don't know as well. They don't know about the navigators who can help them through that prenatal process by making sure they are keeping their appointments or making sure they have all their needs met.
Thanks, Ricki. As you said, there's so many things going on. You said, I don't even remember how it happened. I can share that same experience because, as a mother, when you give birth, there are so many things going on and it's so quick, so I think, like you said, just having those services being offered regardless is very important and critical because and also a doula there as well, because there are so many things going on that the mother, if she's just focused on staying healthy and giving birth birth, all those things are going out the window. So thank you so much. And we had another question from Mazen. I hope I'm pronouncing that correctly. And the question was, if kids have coverage through their parents' job and are eligible for Cover Kids, how do they apply for Cover Kids? Or do they need to apply? I think that's for you, Emilie, as well.
Yeah, hi, Mathen. This is the same process that pregnant women who have Cover Kids, in order to be enrolled in Cover Kids as a child or as a pregnant woman, you can't have any other type of health insurance. You actually have to terminate your other health insurance first before you can apply. If a child had employer-based coverage, they would have to end that employer-based coverage first and then apply for Cover Kids.
Thank you. Another question coming from Joyce Lee: are there any implicit bias trainings in medical or nursing schools? And I'll just throw this out to everyone. Maybe any implicit bias trainings that you know of, which help in addressing health disparities that mothers are experiencing pre or post birth.
I'll say, as far as I know, no. I have a few friends who are prenatal, for labor and delivery nurses, or nurses within the NICUs, and their culture sensitivity and implicit bias trainings are very limited. It's one of those things that are very voluntary when it comes to their scope of learning, because they have so many other things to learn when it comes to their medical test and the MCATs and everything that they have to do. That's kind of put on the back burner of like, it's voluntary, whereas within the field of social sciences, like case managers, like social workers, it's at the forefront, because that is the major part of what those areas do. I don't know too many programs that make those type of trainings mandatory when it comes to their educational dossier.
Thank you, Ricki. And then we're kind of getting short on time, so I'm going to ask one more question to each of you. And as you're answering this question, we have a lot of volunteers on the phone, a lot of advocates. So we want to know, how can we get involved with the issues that you talked about, or your organizations, to help support any advocacy work that you're doing. So, and then the last question is, what can the advocacy sector be doing to support maternal health solutions? So a loaded question. I'm going to go to you first, Briana.
Okay, I'm not sure if I caught the last part, but as far as like getting involved with organizations, so I'll just drop in the chat the name of my org, Healthy and Free Tennessee .org, and people can also email me. And I put my email address in the chat as well. And so, this legislative year is about to end in like a few weeks, but it's, going to start back up in January. And, I know like we are always looking for folks to be involved in the process, and also like other organizations are as well. And so, because we're still in a pandemic, people going and participating has looked differently. I know like this year with the doula recognition resolution, we were, asking folks to like sign a letter in support of the resolution, and like, doing videos and all of that. And so, and that's like, folks who are like impacted by the issue. And in this case, we were like very much so looking for doulas to participate in that. And so like Healthy and Free has an annual advocacy day each year in February that we encourage people to participate in. And I also want to say, like, with our, like, we use like policy work in service to grassroots work. And so we're very clear about that. It's not like, hey, policy work is going to be like the end of things, but that like there are like so many issues when it comes to like the larger issue around like reproductive like freedom, and that's like, you know, where our work is. Like, you know, we're not necessarily just like an organization solely focused on maternal health. It's just like thinking about all the ways that like we can remove the barriers for people to actualize reproductive freedom, and think about a variety of tactics in doing that. And so we also have different educational events. Like we're going to be doing some work this summer like related to education, in terms of like doula care. And I know like it's a question like, you know, what is the difference between a midwife and doula? And, you know, I know like we're running up on time. So anyway, just kind of like clarifying and doing some public education. So like if folks like visit our website, sign up to be on our listserv, you can remain in the loop around, you know, what's coming up with us. And so, yeah, I'll just stop right there.
Jump in. A lot of time for me personally, when it comes to like advocating and supporting, one of the ways people can support when it comes to making sure people can have doulas. If you know a doula, you could always offer to pay for someone's doula care if they are purchasing private care. Or you can look to organizations that have doulas. Like I said, I'm a part of Birth Strides, a birth collective of Black doulas who serve BIPOC moms. They have, I'll drop their website in the chat, but you can donate so that they're able to supply their moms with, we supply them during postpartum with diapers, a handheld breast pump, a body wrap to baby wear. But when it comes to advocating, definitely going to things like the Capitol, writing to legislature, speaking out, supporting those bills, but also just advocating within your community every day of what the needs are for pregnant women. Like Briana said earlier, a lot of people don't see the purpose of a doula because they haven't seen a doula work. They don't know what it's like for those moms who go into a hospital and are terrified, and they don't know what it's like when you're giving birth and you have no idea what your doctor is saying to you, but they're telling you everything that you need to know. So advocating on the basic level of telling people like this is a service you can get, and you know these are the organizations that'll help you pay for it if you can't, or these are the organizations that have it, you know, putting spotlights on the organizations that do it as well as supporting those organizations.
Thank you. And Emilie, I know you've shared information about your organization, but any final words?
Yeah, just in terms of advocacy, disclaimer, our programs at Family and Children's Service, our Navigator program and our Connecting Kids to Coverage program are federally funded. So we actually cannot do any direct advocacy work based on the stipulations of our grants. But that being said, and we encourage people to turn to our advocacy organizations. We have great healthcare advocacy organizations. Tennessee Healthcare Campaign, you guys are one of them. We turn to you guys for advocacy. We do all that on the ground stuff, talking directly to TennCare, enrolling women, helping people, helping women understand their healthcare coverage, and as well as making sure people are enrolled, and public education about the healthcare programs available to people here in Tennessee. So.
Well, thank you so much. At this time, I'm just going to say thank you to all of our attendees. Thank you to our guest presenters for making this webinar possible.